Thank you all for being here today and joining us at the annual IEHP Summit by the PEGASUS Institute in partnership with Canadian Medical Foundation. It's really nice to see many of you here, many IEHPs, our community partners, educators and supporters joining us all in one space. Thank you so much for being here. Before we begin, I would like to acknowledge that we are gathering today on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat peoples. Toronto is now home to many First Nations, Inuit, and Métis peoples. We are grateful to meet here today and to continue learning how we can build more equitable and welcoming pathways for all communities. So our theme this year is Bridging Borders, IEHPs into Practice, which is the essence of our summit today, where we try to bring together the people, the partners, and the programs that help IEHP move effectively towards licensure, meaningful workforce, and also having a strong sense of belonging to Canada as home. And I want to first welcome all our IEHPs. I know this is a Saturday morning and coming early in the morning, we really appreciate it. Thank you for being here. Many of you are balancing your work responsibilities, your exams, family responsibilities. Some of you are just beginning the process, and some of you have already settled in healthcare-related roles. You're all welcome here. And when we designed the summit, we had all of you in mind in such a way that we're able to help everyone in this journey. I also want to extend a very warm welcome to our partners and exhibitors here today. Your presence here just shows us, how collaboration is essential in supporting IEHPs. And so thank you so much for taking the time and coming here. And we are really, really grateful for all the services that you provide. And as many of you saw in the pamphlet, that we are building an IEHP community as a nationwide community where it could provide as a platform for all the IEHPs to come together and network together. That's the main goal of our program, is to make sure that no IEHP feels alone in this journey. So the PEGASUS Institute, in partnership with Canadian Medical Foundations, over the past year, has been expanding IEHP program, and which includes information guidance, mentorship, and also community building. Now, we have a full agenda today, so I'll walk you through it briefly. So we'll begin with our panel discussion on workforce integration and alternative careers with Mohammed Nashat, Dwight Baker, Gilbert, Shongo, and myself. And at 10:20, we move to breakout rooms by profession, medicine, nursery, and pharmacy, guided by our wonderful facilitators, Dr. Philippi Sandos, Dr. Nazreen Alostas, Huda Zrili, Gilbert Shongo, and Dr. Wasim Al-Sabah. At 12, we start our partner spotlight, where each organization will briefly share their work and their IEHP-specific programs. This is a good chance for IEHPs to connect with the partners and ask questions directly, and also to know about the different opportunities available. And then we close the day with final remarks from Dwight Baker. I really hope today feels useful, encouraging, and welcoming. And I really hope this provides an opportunity for everybody to learn and explore. Thank you once again for all of you to being here and being a part of this growing community. Thank you.
Thank you very much, Saida, and welcome everybody here. My name is Mohammed Nashat. I'm an IEHP myself. I'm an international educated pharmacist and IPG. I graduated from University of Jordan. And I'm the founder of Baytech IT Services and Health One-in-One Incorporated. We do IT services, and at the same time, we do for the Health One-in-One, we do health education. So I am involved with the IEHPs-CAN program from the very beginning in terms of the IT support and in terms of the content development. So I'm just going to speak out of my heart because I know this is going to have a long lasting, because we as an IEHPs, we come here to Canada with all the clinical knowledge and experiences that we have, and we come here to face that kind of uncertainty, and we don't know where to start. Like I myself came here and I had lots of hopes into getting my license right away and practicing as a pharmacist here in Canada. But then, I came here and then, like many of you, found out that we have a new culture, we have a new language, we have a new country that we all have to adapt to. And on top of that, we have a family that we need to feed, so we have to work. We have to do all we get to get into this system. So that's why we decided to go with this program, because it's IEHPs feeling providing support to IEHPs. So I am myself, as I mentioned, coming here with lots of things in my mind, and I have to get through all the steps and I didn't find someone to support me. That's why, our panel discussion today team is going to be focusing on workspace integration and alternative pathways. And we will have Dwight Baker, our mentorship coordinator. He's going to be speaking about Ontario and bridging the programs, internships, and how to get your way into education and alternative pathways. And then we have Saida Azam, our project coordinator. She's going to be speaking about Alberta and Nova Scotia in terms of the local opportunities, rural opportunities as well. And then we have online as well, we have Gilbert. He's going to be speaking about Quebec and New Brunswick and the French integration and language there. And so that's actually the concept of the discussion is going to be a bit different, but the challenges are the same. We all face these challenges as an IEHPs, and we're here to support you. And so after this panel discussion, we will be having, as Saida mentioned, the breakout rooms. And we will be also having an AI translation for the IMG session available. You will be getting a pop-up if you're on Zoom. And if you're attending in person, you can see the link that Dwight sent to you, or just go on the website and you'll find the link to go and listen to the audio translation live. Before I pass the mic to Dwight, just would like to invite you, if you are an IEHP, as I said, my journey was very difficult, and I'm still working on my process. And at the same time, I found another alternative pathways. I founded 2 companies, so I am working, I can support my family. That's why I looked into an alternative careers. So I am inviting you as an IEHP, if you're just to consider, if your goal is to get your license, yes, go for it. But at the same time, consider alternative pathways. And that's how you make sure your years of studies just doesn't go anywhere, and then your motivation stays on the top. You don't lose your motivation. So by this, I will pass the microphone to Dwight Baker to go through the Ontario. Right.
Okay, good. So I'm Dwight Baker, and at PEGASUS Institute, I coordinate the mentorship program. And as we gather here today, let me first say welcome to every one of you that took time out of her schedule to join us here today. Now, when we look at Canada's healthcare system, just a bit about my background. I'm an international pharmacy graduate, non-practicing. I'm here in Canada. We look at the Canadian healthcare system. We're at a pivotal point, and you will hear this reflected in the conversations in Parliament. You will hear this reflected in the conversations that you will see in the media and all of that. And it also translates a lot into the patient experience as well, that you will see from time to time at the different healthcare levels, so be it the hospital, the health clinic, whatever the case is. Very short shortages of healthcare workers right across the board. Now, we look at these shortages and you wonder, why is it that you have, on average, and this was from the last information from one of our regulatory bodies, that we have approximately 40,000 unlicensed physicians that were internationally trained here in Canada. What is the challenge that we are having with getting these individuals into the system? And so we need to look at, of course, this right demand, and how is it that we can basically capitalize on the talents that we have, on the skills that we have. All right. Now, there are quite a bit of inequities in the system, and that is something that we also need to be aware of. If it is that you look as well in terms of where these opportunities are, you might have a lot of pressures being pointed as well to, for example, Northern Ontario. You have Indigenous health as well. And so you have all this concentration in the city centers, persons trying to get into roles within the city centers or the larger cities, they're not able to get in. And then you have smaller hospitals, maybe the border towns. For example, you go to Sarnia, you go to Windsor. Okay, these places, they may be closing the hospital doors for however many days out of the year because they don't have adequate staff to run the operations of these institutions. And so while I sit here today, I would just like to make a call out to us as IEHPs. We understand that there are inequities in the system in terms of you integrating, but also understand the landscape and also that there are opportunities, real opportunities that exist for you to integrate. And so while we look at this whole fragmented system that you have existing, we want to look at how we can connect you to programs that exist, programs that work, programs that are at Toronto Metropolitan University. There is physical placement that comes with that as well. Dentists, dietitians, you also have quite a bit of options. So advanced placement into a dental program at the University of Toronto, for internationally trained dentists. Dietitians, you can go to the national associations, you have options there. So you have quite a lot of options that you can actually pursue to integrate into the Canadian healthcare system. And whatever it is that you're thinking about these options, think about the end goal, think about the outcomes. If it offers physical integration, then utilize it as much as possible. Thank you.
Thank you very much, Dwight. And just before we go and pass to Gilbert as well, I would like to ask Saida the same question. Saida, if I'm an IEHP participant listening to you now, what, like something that you suggest me to look into, like a link that I should be opening early on Monday, or an email that I should be sending? Similar to Dwight, thank you very much.
Thank you, Mohammed. As an IMG who is pursuing my licensure here myself, I have gotten a lot of advice regarding this. And one thing that I struggled for a long time, which I'm picking up, is that send the email that you're waiting to send, like to a prospective mentor or someone you're connecting with, or someone who you want to get your advice, or the job that you're applying to, you might think, oh, let me finish this certification and then reach out to them. Let me finish this particular qualification and reach out to them. It's okay, just reach out to them, but let them know that you are pursuing what you're pursuing so that they know that you are interested in what you're doing. I think that will be the first thing to do because that is something that we all struggle with, even culturally. Thank you, Mohammed.
Thank you, Saida. And now I will set the stage to Gilbert to unmute yourself, please, and start speaking.
Bonjour à tous. Moi, c'est Gilbert. Déjà, je suis infirmier autorisé en Ontario et c'est un réel plaisir d'être ici avec vous. Nous allons essayer de vous transmettre un maximum d'informations et des valeurs au cours de cette section. Alors, pour commencer, déjà, il faut savoir que, comme vous le savez, les infirmiers internationaux, de façon générale, représentent les infirmiers internationaux représentent de façon générale une partie des richesses extrêmement importantes, mais seulement il y a aussi effectivement d'énormes obstacles, que ce soit au niveau de la langue et tout ça. Juste pour vous donner un exemple, récemment, il y a Pegasus. Juste pour vous donner un exemple, il y a récemment une recherche de la SNE qui a parlé d'à peu près 85 000 infirmières qui entrent au Canada, mais sur ce, il y a juste 42% qui arrivent à obtenir leur licence. Et donc, nous sommes là effectivement pour pouvoir vous apporter un maximum de valeur. Je pense qu'il y a des questions sur lesquelles je vais devoir répondre. Ça,
Gilbert, on
c'est...
parle. Bonjour tout le monde. C'est seulement pour le Québec et le Nouveau-Brunswick.
Ah,
Ouais.
ok, excusez-moi. C'est parfait. Alors, pour le Québec et le Nouveau-Brunswick, il faut savoir que, de façon générale, la procédure, elle est relativement pareille. Ok, il y a juste des tout petites, des petites différences. Nous allons commencer essentiellement par les Nouveau-Brunswick. Il faut savoir que pour la plupart des personnes qui vont s'inscrire au Nouveau-Brunswick ou dans toutes les autres provinces d'ailleurs, il y a juste des grandes étapes. Ok? Vous avez l'étape, premièrement, de l'évaluation, un peu comme en Ontario, et ensuite vous avez l'étape de l'inscription auprès de l'ordre. Alors, pour la plupart d'entre nous ici, il faut savoir que le Nouveau-Brunswick classe la provenance des infirmières selon 5 catégories. Et pour la majorité d'entre nous, nous nous retrouvons dans la catégorie 5, OK? Donc, les étapes, il y en a 6 au total, OK? Mais la chose la plus importante, il faut savoir que lorsque vous commencez avec la procédure d'inscription au niveau du Nouveau-Brunswick, hein, vous devez envoyer un courriel au service. On va vous envoyer des courriels à travers nos hôtes si dans le courrier dans les données. Vous allez devoir envoyer un courriel au service d'orientation de la DC et ils vont pouvoir vous mettre dans un système, comme on dirait un incubateur. Ils vont pouvoir vous donner toutes les orientations nécessaires. Donc, ça ne change pas. Vous commencez d'abord par la SNEI et ensuite, en envoyant un courriel auprès de la DC, ils vont vous indiquer l'ensemble des étapes à suivre pour pouvoir obtenir votre licence. Ça, c'est pour le Nouveau-Brunswick. Vous pouvez voir dans les slides qu'on vous enverra, il y a les 6 étapes effectivement qu'il faudra franchir. Et puis pour les Québec, la petite différence, c'est que au Québec, contrairement au Nouveau-Brunswick, nous avons la MIFI, c'est-à-dire le ministère de l'Immigration et de la Franchisation, qui va commencer d'abord par faire votre évaluation. C'est par ça que vous commencez avant tout. Et ensuite, vous allez vous inscrire auprès de l'ordre. Pour le Québec, la particularité aussi est que vous allez faire d'abord votre évaluation auprès de la MIFI et ensuite, il y aura une seconde évaluation auprès de l'ordre. Donc, en gros, c'est vraiment ça. Et ensuite, vous avez les 10 étapes qu'il faudra franchir après la reconnaissance des diplômes par l'Ordre des infirmiers du Québec. Il y a des cégeps qui sont attitrés. Vous avez un programme effectivement d'accompagnement jusqu'à l'obtention de votre licence. Il y aura des questions, ne vous en faites pas, il y aura des questions plus tard. Nous nous ferons le plaisir de vous répondre pour être un peu plus bref. Ouda, c'est parfait jusque-là?
Merci. Next.
Oui, c'est très bien. Merci beaucoup, Gilbert. On va vous partager beaucoup plus de détails juste pendant la présentation de plus tard en français.
Exact.
Merci.
Merci, Gilbert.
Merci à vous.
So, just thinking about the time, I will start with asking some questions to Saida now about Alberta and Nova Scotia. So, first question we have for the panel, Saida, is what are the current or planned provincial initiatives in Alberta and Nova Scotia that promote the integration of IEHPs into the healthcare system? You touched based on it a bit, but we appreciate if you can.
Thank you,
Yes.
Mohammed. So, like I mentioned, we have a few information regarding Nova Scotia and Alberta. So for Nova Scotia, we have something called as the niche program, which began as niche program and then expanded into the niche 2, which is expanding niche program. So this is it is from Nova Scotia Health, and it focuses on recruitment and retention of internationally educated health workers by supporting work, family, and community connections so that people can actually stay in the province. So it first started only for internationally educated nurses, and now it is expanded to 5 professions, which includes licensed practical nurses, medical lab technologists, medical imaging professionals, pharmacists and pharmacy techs, and respiratory therapists. In addition to that, we also have something called as continuing care assistant strategy. So there is, in this particular strategy, what happens is that they provide free tuition, textbooks, and also some fees at some specific institutions are covered in exchange for 2 years of return of service commitment in Nova Scotia in the continuing care sector. And they also cover fees for the recognition of the prior learning assessment, which is also a good thing, I believe, for those already working in that sector. And this is briefly about Nova Scotia. And for Alberta, we have something called, the practice-ready assessments are already in place for a very long time in Alberta. And that is a route for international medical graduates focused on rural and underserved communities, which gives a restricted license tied to service in communities of need. And we also have some new pathways and supports for internationally educated nurses. So in this, what happens is that they may be able to obtain provincial permits while they prepare for and write the NCLEX exam. And there are also bridging programs at several institutions, including University of Alberta, where it uses a 12-week structure with clinical components to help internationally educated nurses. And there are other alternative clinical routes like Alberta Clinical and Surgical Assistant Program and Associate Physician Program. And these are some of the options that can be considered for IMGs in Alberta. And there is something called a SMART initiative, which is brilliant, I believe, because the goal is to reduce barriers to foreign credential recognition and place IEHPs in positions aligned with their skill. And I believe one of the collaborating organizations is AIMGA, so you may be able to get more information from them as well. So this is briefly about Nova Scotia and Alberta. This is only a brief outline. There are many more information available. We'll be happy to connect you with organizations which can give you more in-depth information on that. Thank you.
Okay. Saida, we have another questions for you.
Yes.
How can IEHPs take advantage of opportunities in rural or remote areas, and what supports are in place for relocation or adaptation?
Thank you, Mohammed. So for rural opportunities, I believe, like Dwight mentioned, there are many rural areas which are in need of health services and health workers. So I think it is important for international educated health professionals to focus on those positions as well, so that we can expand our opportunities. So in Nova Scotia, in Nova Scotia Health, they promote a volunteering opportunity and also student placements if you're in one of the programs, where you can jumpstart your career and gain some experiences in the rural facilities. I think they are unpaid, but it opens the door for you to get into the healthcare system as a volunteer. And if you have already obtained the license, then they have some rural practice incentives and tuition relief for those IMGs who are willing to go and work in the rural places. And we have a Physician Assessment Center of Excellence, PACE, where international medical graduates get assessed for a 12-week period under supervision. And if selected, then you will have to do a return of service in the rural areas for 3 years. I think Dr. Philippi Sanders will be able to explain all these in detail during your breakout session. Thank you so much for coming today. So this is about Nova Scotia and about Alberta. So in Alberta, there is something called as a rural renewal stream, but that is mainly focused on immigration. So if you have a full-time job offer in one of the rural areas, which has at least 30 hours of work experience that will help you through the immigration process, it may not be applicable for everybody here, but if any of you are here already in Canada, but going through immigration process, this is something that probably we can have a look at. And they also have, like we mentioned already, the practice reassessments and the associate physician and surgeon roles. If you express your interest in serving the rural communities, it is observed that you have more chances of getting in. So always during an application process, one thing that I've been able to find out is that in all the application process, it is important to emphasize that you are interested in providing service to the rural communities. That will jump up your application to some levels. Thank you.
Thank you, Saida. And I'm going back to Dwight and ask a question about Ontario. And Dwight, how can IEHPs access entry-level roles, volunteer, internship, or observership opportunities in hospitals and primary care settings?
All right, thank you for that question, Mohammed. Now, I will say I am from PEGASUS, all right? We have an excellent program, and I will start off with the IEHP program that we have here at PEGASUS, all right? Now, we connect IEHPs to volunteer roles or observership shadowing opportunities within your specific discipline. And so, with that being said, I want to start out with the whole idea of broker, all right? So when you go as an IMG or as an IPG, International Pharmacy Graduate, International Medical Graduate, Internationally Educated Nurses, you go individually to these organizations and you ask, okay, can I volunteer? Or do you have any roles where I can work? Seldom are these individual consultations or contact successful. Use a broker. So you use an organization that has a relationship with these institutions. And up to this week, I had a conversation with an IMG saying, okay, can you contact Health Force Ontario for me? Or can you contact Ontario Health for me? You understand? And so in terms of our role, this is how we support you as an internationally educated healthcare professional. We bridge this gap for you. So when you're working, they may not be receptive to you. And so we play that critical role to link you to the system itself. You look at the bridging program that I mentioned earlier as well. Those are also structured forms for you to enter the system. And so you must be ready to take up those opportunities or engage in those opportunities whenever they arise. You have the Bridge Training Ontario, and most of these programs are funded through Bridge Training Ontario. So you may access them without financial or thinking about additional financial burden on you. For some of those programs that you may have to pay to do the program or join the program, there's also Ontario Bridging Participant Bursary that is accessible for those persons who have financial need. And so that is another way as well for you to get resources to support you integrating into the system. And think about the geography again. So I spoke about the border cities. You have a lot of those that are out there. So you have the Windsor, Niagara Falls, Fort Erie, Sault Ste. Marie. Go out to these places, go to Rainy River, go to Cornwall, go to Kenora. If it is that you want to engage in Indigenous health, go to these farther places as well. Let me tell you something. When you look at the pay rate, for example, that you might find in, say, a Greater Toronto area for a non-licensed role, you will realize that if it is that you go to one of those smaller cities, because the demand is there, you have the option to bargain. They will also provide settlement support as well. So if it is that you're thinking, okay, I don't want to go so far because I don't know anyone there, or I don't want to go to this smaller city because of all of these challenges, there is support that is offered. There is also employment support, and we have organizations that will support you for those purposes as well. So you have employment incentive. We have conversation from time to time with a CISO. We have Success here with us today. We have Achieve here with us today. These are organizations that will offer employment incentive for these institutions or organizations to employ you as well. So you don't even have to think, okay, am I just gonna be volunteering, or am I just gonna be working for free all the time? No, that is not the case. That's not what we're saying to you. So there are opportunities out there, but you just have to be flexible and be open to the possibilities that exist. And so we have in Ontario, the Access Center for IEHP. Now that the organization itself, they connect you to employers. They from time to time will have sessions for our IEHPs, providing guidance on the licensure pathways, how to get employment, how to get into these volunteer roles, how to integrate into into different organizations itself. Use these brokers that are out there to connect to the system as much as possible. Thank you.
Thank you so much, Dwight. And I will actually invite Dwight now just to ask a question for Gilbert in French.
Bonjour. Pour Gilbert, quel rôle alternatif, exemple, aide-soignant, assistant administratif en clinique, soutien communautaire, sont accessibles pendant période précédant la pleine reconnaissance professionnelle?
Alors, les rôles alternatifs que vous pouvez effectivement prendre en attendant l'obtention de votre licence, pour la grande majorité, c'est même vraiment ce que moi je recommande en particulier, c'est que vous avez déjà les métiers des préposés aux bénéficiaires, ok? Ça, c'est super important parce que il faut savoir qu'après, une fois que vous aurez votre licence, vous aurez la possibilité effectivement de gérer même les équipes des préposés, et vous serez à contact aussi avec les autres infirmières, voir un peu comment est-ce que les choses se passent. C'est une très bonne alternative, et déjà, selon les gouvernements, c'est vrai qu'actuellement, il y a une formation qui existe là-dessus, mais vous pouvez également avoir une formation en cours d'emploi, c'est-à-dire pas forcément besoin d'avoir un diplôme, étant que vous êtes infirmière internationale, vous n'avez pas besoin d'une formation. Si l'employeur vous accepte, donc c'est parfait. Il y a aussi des rôles au niveau des assistants administratifs, par exemple. Et là, ça dépend encore une fois de plus de l'employeur, état qui est infirmier, infirmière internationale. Vous êtes accepté dans ce genre de postes, par exemple, pour assister au niveau des équipes d'hygiène. Vous êtes vraiment dans l'administration, des choses que vous connaissez. Ça ne vous éloigne pas trop du domaine de la santé. Donc, ça, c'est les deux rôles que moi, je recommande en particulier. Vous pouvez être soit préposé, ou soit vous pouvez être également assistant, assistante administrative.
C'est parfait. Une autre question. Comment les obstacles linguistiques affectent-ils les accès à l'emploi et à l'intégration, même pour les professionnels expérimentés?
Tout à fait. Alors, l'obstacle linguistique, ça c'est très intéressant parce que il faut savoir que ça commence même un peu plus loin que ça. D'abord, nous allons commencer par l'accès à l'emploi. Dans le cadre de cette rencontre, j'ai fait une recherche dans les sites du gouvernement Guichet Emploi pour voir les offres d'emploi effectivement accessibles en anglais et en français. Sur les 50 offres d'emploi, par exemple, que j'ai pu identifier en Ontario, vous avez 42 qui exigent uniquement l'anglais. OK? Pour nous qui sommes francophones, vous imaginez, ça doit être super difficile. C'est-à-dire que si vous avez des emplois qui existent uniquement en anglais, ça peut être un problème. Et il y en avait deux seulement qui acceptent les français et deux exigent d'être bilingues. Donc, au niveau de la langue, ça pose problème, effectivement. Et puis, il y a aussi au niveau de l'intégration, comme l'indique la question, c'est-à-dire que vous avez de collègues ou des patients qui mélangent, c'est-à-dire l'anglais et le français, voyez-vous. C'est-à-dire que déjà, par exemple, pour les dossiers, la plupart des dossiers sont en anglais. Ça, c'est déjà un problème, surtout en Ontario, par exemple. Au Nouveau-Brunswick, je n'ai pas travaillé, mais en Ontario, c'est le cas. Euh, Vous avez des patients qui vont mélanger des mots, ils vont te dire, par exemple, j'ai un rash. Donc, pour une personne qui ne sait pas ce que c'est un rash, tu vas chercher dans le dictionnaire français, c'est difficile. Donc, ça ralentit un peu l'intégration. Et si nous pouvons revenir un peu plus en arrière, voire même au niveau de l'obtention de la licence, il y a aussi des obstacles dans le sens où l'examen NCLEX que vous devez passer, par exemple, l'ensemble des données pour préparer cet examen se trouve en anglais. Donc, déjà, ça, c'est difficile. C'est vraiment l'obstacle au niveau linguistique qui est une barrière importante.
Merci beaucoup, Gilbert. And now it's time for our breakout sessions. So if you're attending in person, we are here to help you. And if you're virtual, you'll soon get like a pop-up on your screen to join your professional channel. Thank you.